Good evening and welcome to the Jason Roberts Foundation and this discussion on the vaccination. I'm glad to have our special guest speakers today, Mr. John Licorice, or Dr. John Licorice, should I say, Dr. Patel. I believe we're going to be joined by Dr. Joan. We also have three young panelists there, Mikhail, Patience and Marley, who I'm sure may have some questions that are going to be directed to our guest speakers. But for now, if I can ask the guest speakers just to tell us a little bit about your background. John, first, please.
Hi, thank you for inviting me. Good afternoon, everyone. My name is Dr. John Licorice. I am a public health consultant at Brent Council. What that means in special terms is I'm a doctor and I work in terms of public health. So my area of work is in terms of doing things that prevent you to get diseases such as vaccinations, and also in terms of advising people on how to do things that will help them to live and work better. And a lot of my work is also about helping young people engage with health services. With this pandemic, I've been doing a lot of work with vaccines. Is that something that I used to do in a younger life? I did a lot of work with vaccines.
Dr. Patel.
Good evening, everyone. My name is Emerson Patel. I'm a general practitioner from Wembley, and I've been in Brent for 30 odd years. But I'm also on the governing body of North West London, CCG, and I'm the borough clinical lead for Brent. Amongst my roles is to oversee the vaccination program from the borough perspective, but I also lead on other things within Northwest London, primarily all the diagnostic work, pathology, respiratory, and I also am closely involved now with development of the new sort of diagnostic hubs, which hopefully will bring diagnostic capability and facilities out in the community, and that's at a London level, but we're also working at Northwest London level. So it's a pleasure to be here. And I work very closely with John Licorice, who I've known for many, many years.
Oh, thank you. Thank you very, very much. Well, listen, we're going to make this nice and informal. We're hoping some more young people are going to join us, but the three of you that are up there on my screen anyway, up in the corner, we're going to be directing quite a lot of this to you because we want to hear your voices. But for now, I've got a general question that I'd like to pose to both the doctors, which are, what are the associated risks to society if young people are not vaccinated? There's been a lot of talk about this at the moment, but there doesn't seem to be clarity. So maybe you could help clear that up for us.
John, do you want to take that first and I'll come in?
Yeah, thanks for that. Yeah, I think first of all, we talk risk to society. I think there's lots of risk to young people. I think early in the pandemic, you may have heard that COVID didn't really affect young people so much. And the impression people got, it wasn't so important. As you know, we run a vaccination program on young people. I were the last persons to be vaccinated. I just want to make it, I think everyone to be clear that the virus that we have now is slightly different from the one that was started in the beginning of the pandemic. And we do know that some young people are getting very ill by COVID. Some of them are getting very ill and getting into hospital. So that's the first point. The second thing is that you may have heard people talk about something called long COVID. And essentially what that means is that after most people get COVID, they usually get sick, they get very unwell, and then hopefully they'll get better in a short period of time. But some people get prolonged symptoms that can last for months and months, and in some cases over a year. And what we know is that even though young people by and large don't get lots of serious disease, we do know that they do get long COVID. And you know, that can do lots of things. It can affect your ability to concentrate. You cannot feel well. You can feel very tired. You cannot be able to move around. So I think we need to be very clear that COVID is an issue to our young people themselves. You would also been aware, and you would have been heard, I guess, in some of the campaigns about, you know, about affecting your elderly relatives, your mom, your grandparents, who tend to get COVID and tend to get very ill. So yes, it's very important from that perspective, to try, to get vaccinated to protect your elderly relatives. But I think you also need to be aware that you as young people are prone to get ill. And I think that's a really important message, either in the short term and also in the longer term. So I think it's really important that people understand that the current situation as it stands right now with the particular type of virus that we have circulating. I don't know, Dr. Patel, you want to add anything?
Thank you, John. I don't really want to add any more. I think you've covered most of it. Thank you very much. But I would like to say to young people in Brent that this is about looking after our communities and our society as well. So it's about preventing that sort of transmission of COVID to those who are more vulnerable and elderly. And what we are seeing more recently is some people who've been double vaccinated still getting COVID. And that's probably as a result of relaxation of rules, but also to do with the fact that we're starting to open up now, and COVID is right, and the Delta variant, as John says, is very different to the original strain that came along and didn't affect young people as much. But we do know that somewhere in the region of 1 to 5% of young people who will get COVID go on to develop symptoms of long COVID. That symptoms 4 weeks after they've had COVID, and progressing on from there. We're still learning about this virus and the variants. So this is a new virus for us, and we're just learning new things about it all the time, as John will testify.
Right, I'm going to come to the three of you, but I'll go Marley first. Marley, what do you understand about the vaccination process?
Not much, to be honest. I don't actually know that much about it.
Is that because it's not a subject amongst your friends, or it's not something that as a subject, meaning whether that's regardless of whether you believe in it or not?
Just haven't really spoken about it, to be honest. Just kind of, we've kind of seen it as something that like the adults kind of get, not really us.
Okay. So you relate to it being more something to do with adults. Patience, same question to you.
Same really. Like when you think of the pandemic, you just think of, oh, okay, we just get breaks of school and that's about it.
Okay. And Mikhail?
Yeah, as Molly said, like it's not really like the younger people don't really phase about it, and like it's all about the elderly people to like the middle-aged people who is really concerned about, but it's not really spoken about in like the younger groups.
So when you hear an explanation like Dr. Licorice gave, what does it make you think?
Makes us think more about like why it's needed for like the world, but it still doesn't, like we still don't know if we're supposed to be like vaccinated or not, and if it's gonna help within the world.
Okay, let me come back to the doctors. What I hear is where can young people go to find trusted information? Because at the moment there's a lot of information out there, but there seems to be a lack of trust or a lack of understanding. So we're not grabbing our young people in the way we could. Have you got? And I expect Dr. Licorice, as you're working in the community, there may be, you could probably expand on that.
Yes, I think that's really important, and I think my colleague will put some links in the chat. I think you should try to always remember that the NHS, is a source of trusted information. There's lots and lots of misinformation out there. A lot of it will come via social media channels. A lot of it comes via general conversations. Some of it, unfortunately, may come via older people. So I think there's a lot of misinformation out there, which is not necessarily what you want. There's some trusted sources of information in the NHS. Has lots of good information on not just for COVID, but for anything else generally. The council, through its website, has a special page which can give you, and social media links, which can give you trusted information with regard to this vaccine. I think that's really important, is to get your sources, get your sources of information, because this is an important condition. I think young people do need to speak to it. I was just looking at, before this meeting, at some data, looking at for vaccination uptake, and looking at some of our young people and some of our uptake rates. Some of our young people, almost half of what they are in other communities. So I think, I'm not sure how old young people are, but I mean, these are the 18 to 30-year-olds. So it's something I think we do need to, as a community, talk to and have a chat about, and look at these trusted sources. As I said, my colleague has put them in the chat, but for the NHS, the council has a really good website. The government has a really good website. If you need to talk to someone through yourselves, you can point us to people you can talk to. We've got a vaccine bus that travels around the borough. You can get, if you want to, and you can pop by, and some people have done that, actually, pop by and spoken to us at the bus. They can give you lots of good information. So I think it's really important. I'm going to ask you, when you may hear things from your friends and from other people, but I think it's really important that you see trusted sources of information, because there's lots of stuff around this, around the vaccine, around the virus, which isn't true and isn't founded in anything really true. And unfortunately, we are spending a lot of time listening to it. So I think it's really important that you look at these trusted sources and speak to people in authority who can point you either to these links or to this information. As I said to you, there are some links there that we've put in the chat that which you can use at your own time and gather information, and lots of questions there and lots of different things which you may have.
Okay, Dr. Patel, do you want to add to that?
Thank you, Michael. I just wanted to say to the young people who are on here today, I mean, look, this is, it's great to be able to speak with you and discuss this with you today, but, many of us would be willing to come out to your local groups. If you'd want us to come, happy to do so, and happy to bring some of my colleagues with us to come and talk to your groups that you have locally, if anybody wants more information. I think John's absolutely right. There are some trusted sites, and one of the ones I would point you to is King's College London's site as well, which has some myth busting or myths debunked site, which is really an interesting read. And it's important that we counter some of the myths that are going around about COVID. But I think it's really interesting to hear that from the three speakers earlier, that this is not really much talked about amongst young people at the moment. And I think that is something that we really need to start getting going within the younger population. Is how do we engage with the younger people to get them to talk and understand about COVID? But it's a real problem, and it's not going to go away.
One of the doctors mentioned, influenced by family or friends or some of the stuff that's out there. If you're a young person and some of the information that's being presented to us as adults is confusing, how do we start to sort of work that out as a young person? Because at the start of the pandemic, we were being told one thing, and at the end, not the end, we haven't reached the end, but through various phases, we get told something else. So how does a young person navigate their way through that? Any of the doctors, that's too.
Yeah, if I can start, I mean, it is extremely difficult if you're a young person and your peers are telling you one thing and you're hearing or you're hearing a different version of events from people who you normally associate with or you're in contact with. I think it's extremely difficult. And I think that the thing to remember is that we do have Public Health England, which produces figures, and we have local figures. And I think that the only way for a young person really to get to know what the truth and the reality is talk to somebody who either is a professional or who has knowledge about this. And I think that, you know, though it's difficult, the fact is that, you know, I also think that young people can be the champions as well. So it'd be really nice to get some young people coming forward to understand some of the detail about COVID vaccination and COVID itself, who can then go back and talk to their peer groups, because, you know, people listen to their own peer groups more than they've listened to us, because you know, there's always a historical sort of mistrust, etc. And we need to get over that. And it's a really difficult. I don't know the answer to that, Michael, but we can only get to a solution by working together and seeing what works best for our young people. Because our interest is in protecting them as much as protecting anyone else within our community.
Okay, well, okay. Angela, I can see you've unmuted yourself now. Do you want to ask your question?
It's a good forum. And I think from a lot of the children that I've spoken to, most of their parents haven't had the vaccine. That's why they haven't.
It's a very good point. It's a very good point. So, parental influence, and I'm assuming that the numbers are very high in the Black and Asian communities for that as well, aren't they?
Yes, the refusal rates tend to be higher in our communities, and also the people who don't take the vaccine, a lot for a variety of reasons, are also higher in our communities, and that's very true in Brent as well.
You know, just to go back on the point about parents and, you know, whether they've had the vaccine or not, I completely accept that. We've also had cases where parents who wanted the vaccine, but children have said no, they're not going to have it. And that's recorded in almost every practice that I've spoken to. So, you know, it works the other way around as well. So we just need to get the right messages across and try as hard as we can. Look, this is about all of us working together. It's not about somebody saying you have to have this. It's about, you know, if you have genuine queries and concerns, then ask the people. And as John and I and our teams would be more than happy to go anywhere in the borough to talk to groups and try and get over the facts to people if that's what they want. We really want to see Brent. You know, Brent suffered very, very severely in the first wave, and we really want to make sure that we can protect as much of our population as possible.
Yes, I just want to add to that, MCS. Again, just to let young people know, we really suffered really badly in the first wave. Lots of people become very ill. So unfortunately, some of them died, and Brent was in that very first wave. So yeah, so we really do want to try to do all that we can do to mitigate, to stop that. So, you know, as Dr. Patel says, we're happy. We've got lots of people who are happy to come and talk to anyone and anywhere about that, because I think it's really important that all of you have the information that you need, you know, because most of you, I suspect, are far better with the internet and social media than I am. So it's really important that you can get some good information if you have questions, because it's good to have questions. There's nothing wrong with questions. Questions are really good, but we can get the right people to answer you those questions.
Yeah, it looks like, Mikhail, your group there, you, Patience and Marley, one of the hands up. What's the question?
It's not necessarily a question, but the statement that parents don't have the vaccine is necessarily why the kids aren't getting it. We don't really agree with it. It's like, I feel like social media plays a big impact, because on social media, you'll see videos of people who have the vaccine, but then come out with a very, very bad outcome. Like, for example, there was this girl, she got the vaccine, and then like now she's almost paralyzed, she can't walk. And apparently it's due to the vaccine because she got it. And then things like that get circulated around social media, and it goes around very quick. So as a young person, you're already skeptical about the vaccine, and then you see videos like this on social media, and it's like, okay, now I don't want to get it because look at A, B, C, D and everything that's happened.
It's a challenge. Dr. Joan, you can hear what Patience said there. I mean, that's quite challenging, isn't it?
So Patience, I hear what you're saying, and I think that it's very difficult when you see messages on social media, because the messages, unfortunately, in my experience, tend to be quite scary, and they highlight legitimate concerns that people would have, but they put a certain negative spin on it, if I can put it like that. And you said apparently that this person had the vaccine and then had this reaction. And I think that's one of the difficulties about social media, is that how can you verify? How can you verify that that person did have the vaccine? How can you verify that the symptoms or the signs that they've got are associated with that vaccine? And it's very difficult to do that on social media. So I think we as healthcare professionals have a responsibility to give people the information that they are asking, and hopefully give you the information that you require and back it up with evidence. Whereas on social media, how can you evidence what you've seen?
That's a very good point. But obviously, I think for the young people, everybody's talking about it in that respect. In other words, nobody's going to talk about somebody who's had a vaccination and they're all okay. You know, the things that's going to be highlighted is where it goes wrong. Yes, doctor, please.
I completely understand the concerns when you see reports like that in social media, but one really has to put that into perspective. So if you look at the number of cars on the road and a number of people who are seriously injured and the fatality rate, so your chance of dying is 2.7 per 100,000 people in a car accident. Okay. With the COVID vaccine, the early reports were that it was 0.2 per 100,000 in the 20 to 29-year-olds. And then as you got older, that risk fell. So we really have to get the risks right. And no program is going to be 100% safe, like no medication is going to be 100% safe. So, you know, we just need to get those risks into perspective. And whilst I understand, you know, the anxiety that's caused by, you know, reports like that, and it's really unfortunate if this young girl or young person did have an adverse event as a result of the vaccine. Remember, for every one of those, there are hundreds of thousands who have been protected, and they didn't have any adverse reactions. I think we just got to get the balance right on that.
Well, one of the things that we could do right here in this forum here is to start to talk about some of the known side effects that are rare, that are associated with taking the vaccine. What are some of those side effects? I know fertility has certainly been raised as one, but again, it's not pervasive. It's not something that's spread wide. So can we demystify that the whole aspect of side effects?
Yeah. So very commonly, one of the short-term side effects that people will get from the vaccine is a sore arm. So that's very common. Not talking about a sore arm that you can't use, just aware that you've had something in your arm. So that's one of the short-term effects that people get. One of the other short-term effects that you might get is things like headache. You might feel tired. You might feel like you've got muscle aches and pains, those sorts of things. That normally lasts for a day or two, should be better within a few days. So those are the short-term side effects that you can get. Some people, I find that they react to the vaccine with this. Essentially what's happening is when your immune response kicks in, it gives you those symptoms. And some people seem to get that with the first dose, but some people are fine with the first dose and they get it with the second dose. But most people either get it with the first or the second dose. And then the other concern that people have had was about the clots, but the risk of clotting or clots, let me put it that way, and these rare side effect of clots is greater actually with COVID infection than it is with the COVID vaccine. Michael, you said about fertility, but there is no associated side effect with the vaccine and effect on fertility. Okay, so I just want to make that very clear.
And that shows you how that message gets around, doesn't it?
Sure, because of course people, as I said, people are concerned. You know, people have legitimate concerns, they have legitimate questions, and they have legitimate fears. Yeah, but there is no association with the vaccine and effect on fertility. It hasn't been found.
Okay. Fantasia, I'm going to come back to the other doctors on that point to expand, but I noticed, Fantasia, you got your hand up. So do you want to ask a question?
Yeah, how many different types of COVID vaccines are there, and what are the difference between them?
We have to say in the UK, because internationally there are over 100 COVID vaccines, but we have 4 types of vaccines which we have here, which are licensed by the specialists to be used here. The most common one, which you most likely at your age will be given, will be the Pfizer vaccination, which is one that you heard about. The other one is the AstraZeneca, which tends to be given, was mostly given to older people like myself. We also have a Moderna vaccine, which is another one which can be given to younger people, but we have less of that around. And we have a Johnson & Johnson vaccine, which we don't have much of that around either. So yes, we've got multiple vaccines, and always with these things is that the one that we offer to you is the one that's best for you, because sometimes people ask which is one I should get, and the experts have looked at it, and as I said to you, the ones that we offer to young people are the Pfizer and the Pfizer and the Moderna vaccine. I just want to touch back on the point about about side effects and whatnot, and the social media. I think we always have to remember, as Dr. St. John touched about, we always need to look and see where's the sources, what are we seeing, and what's our sources of information. If you saw something come on social media, you saw me doing a reverse bicycle kick and scoring a goal, I suspect you will look at it and say it's not possible. That can't be true. Yes, it's not possible at all. My footballing skills were very poor. So, but on the other hand, if it's something about vaccines, I do know a bit about it, and most of my colleagues here, we do know a bit about it. So I think you always need to balance that. When you see something, have a consideration and say, where is this coming from? And is this someone who's an expert in that particular in that particular area? And I think that's very important, touching back to the point that Dr. Patel was saying. There are people who know a lot about these things and are able to put these things in context. Whereas you may receive something in a nice little video, which is professionally made and looks very graphic, because it often plays on fears. But the question is, the fear might be confounded, but is it true? Who did it? Why was it made? And does it look at the whole picture, the whole story?
I'm just going to make a comment about the side effects of some of the vaccines.
Yeah.
In addition to what Jane was talking about, there have been some reports of what we call myocarditis, which is inflammation of the heart, and pericarditis, particularly with one of the vaccines, and I think it's the Pfizer vaccine, usually occurring, several days after it. But in most cases, it resolves itself and it's not serious. So, and that sort of occurs more in those who are less than 25 years of age. So that is something that has been reported lately. I just wanted to be clear, because I think that we just need to be honest with everyone, but it's not a major problem. So you might see on social media about, somebody had a heart inflammation or whatever. Most people recover very well with that, and there are very, very few cases anyway. So I just wanted to say that. And I think that the other thing about social media is, remember, anyone can upload anything on social media, and that's a great thing about social media. That's also the worst thing about social media, because there are no checks, and I think you just have to be very careful about the source of the information.
Okay, thank you. Mikhail, Patience, and Marley, someone's got a question?
Yeah, how long does protection from the vaccine last for? Before, is it like a yearly thing, like the flu vaccine, or is it just like a permanent thing?
Well, at the moment, I think there's no evidence that it provides long immunity, because what we do, that's why we have the booster vaccine program coming up in September. So I think we're still learning about it. I think John, you might have some better figures, but in terms of immunity, we do know that unfortunately in some people that immunity wanes quite rapidly, in others it continues for a longer period. But what we do know is that the second vaccine affords you a better protection than just having one on its own. And as you know, there's a third phase of vaccination coming in September, and we hope that that will provide even better immunity for our patients.
For some viruses, you get lifelong immunity. You take a dose and 2 doses, and it will last for long periods of time. With many, the immunity just wears off at a particular length of time, and that's something that we are continuously monitoring because this is a brand new virus with many variants. So what we do know is in that some particularly in older people, we know that the response is boosted by a third dose quite significantly. You can get up to 10 or 11 times boost by having a third dose, and this is why people are now looking at doing a third booster dose. The question I'm often asked is, will we have an annual program like a flu vaccine? The question is, we're not quite sure yet. We have to continue monitoring how this virus is going to behave. But there's every expectation that people will have to have booster doses in the time and in future. And some of you may be aware of the flu vaccination that comes wrong that's given to you in school. So there may well be at some point in time in the future where this may well happen. But as it stands, as Dr. Vital says, we've made the need looking at how the immunity is falling off in some of the older people, particularly who had the vaccine first, because they've had their doses in some cases almost 9 months. I just want to make the other point, because you may hear, well, I'm going to have some people say, well, I can catch COVID anyway, it doesn't matter, I'll be immune anyway. The immunity from getting the disease is unpredictable. So everyone we know will, generally speaking, get some immunity for about 3 months, but usually immunity from having the disease wears off quite quickly. So getting COVID is not. So in other words, you can get COVID, or you can get COVID again and be quite ill and unwell. So that's just a point to note.
Fantasia, I can see you got another question.
Why is the government trying to persuade the youth to take the COVID vaccines? Would it be safe for them to take?
The expansion of that question, Fantasia, good question, is we've noticed that the government has started to offer young people incentives. I think there's a strong case for taking a stance, but incentives, does that not sound like it's almost like bribery? Surely the science should lead and not the incentive. Dr. Jones.
I think in terms of, we talk a lot in medicine about risk and benefit, and in life we talk about risk and benefit. What's the benefit to me as an individual? What's the risk to me as an individual? And you have to weigh those two things up. For a young person, in some ways, the risks are not as great as they are if you're 18 compared to somebody who is 80. I think we have to accept that. But that's one aspect of it. The other aspect of it, I mean, we talked about the government, but what the government are trying to do is basically public health. So not just looking at one part of the community, one part of the population, but looking at the population as a whole. And how do we protect the vulnerable people within our population? And we do that by trying to vaccinate as many people as possible. So as many people as possible are protected against the virus, so we don't allow the virus to have these things like the mutations. Because although as a younger person, the risk to you as an individual is not as great as it would be when you're 18 compared to when you're 80, if we're going to protect the 80-year-olds or people with other conditions who are more at risk, then as many of us as possible have to be vaccinated. Okay. With regards to the incentive, yeah, I have a problem with that. Because I think to myself, this makes good sense scientifically. It makes good sense for us as a community to protect ourselves and protect the, people in our community. So why do we need an incentive? Because we shouldn't have to, be almost like paid, because I think they're actually paying people in the States to take the vaccine. I have a problem with that. I think that for the sake of yourself, for the sake of your community, if you make that decision to have the vaccine, then that should be sufficient. I don't think the additional thing of having money or, pizza or whatever is necessary. That's my feeling. That's my personal feeling.
Renee.
Yeah, I kind of jumped in and caught the incentives part, and that kind of bit interests me in a way where, why are they promoting incentives so much instead of a healthy lifestyle more? So Deliveroo are giving away vouchers if you get the vaccine, but when you look at Deliveroo, a lot of their food is fast food, junk food, ultimately not the best for you. So I don't for a young person, it doesn't make sense to go, right, I'll get the vaccine so I can get cheaper Pizza Huts or McDonald's. Ultimately, that's going to drive my health lower with it. And I hear a lot of young people say, even with the vaccine, they're catching COVID. So a lot of young people are now kind of in two minds with incentives. The government's confusing them. So it's just, I don't know, I think it's just too much information and offers going out for something that's meant to save your life.
Yeah.
Rennie, can I just add something?
Yeah, of course, please.
So, Rennie, I mean, yes, people can catch COVID after they've had vaccinations, but I think one of the things we have to clarify also is it one vaccine that they've had? Because you only get a certain amount of protection with one vaccine. You get more protection if you've had 2 of the vaccines. And even if you've had 2, because of the variants, it is still possible to get COVID. So, as we've said, nothing in life is 100%, but you will get much more protection if you have the vaccine than if you don't have the vaccine. That we do know.
Mikhail and Patience and Marley, I can see your hand up.
For me, I just don't see a point in a vaccine if you can still kind of catch the disease. I don't understand. I thought like vaccines were meant to give you like full immunity, or not full immunity, but close to full immunity. But loads of people seem to be catching COVID after they've had the vaccine. So I just don't kind of understand that.
Marley, hi. So Marley, one of the examples that I often use is seatbelts, because I can remember, I'm old enough to remember when it wasn't compulsory. And if you get in a car and you put a seatbelt on, you're probably going to be protected against having a serious effect if you're unlucky enough to get into a road traffic accident. Yeah. But if you don't have the seatbelt on, the chances are it's going to be worse for you. The seatbelt doesn't protect you 100%, but it is going to give you some protection. And the vaccines are like that. The vaccines are like the seatbelt. They're going to give you a lot more protection than if you got into that car and you didn't put your seatbelt on and you had an accident. So nothing in life is 100%, but it's going to give you more protection than if you don't have the vaccine. And as I said to Renee, the people who you know of who've got COVID after having the vaccination, the question is it one vaccination they've had? Is it the double vaccination they've had? Is it a mutation that they've caught? So it's very difficult to say.
Yeah, so I would also add to that is also length of time after the vaccine. You have the 2 doses before you get full protection. There's a 10 to 14-day period. So it's a timing that's there. Yeah, I'd just like to give you another analogy. It's like a house. If you've got a house and you've got a front door, you've got a back door, and you've got windows, having a vaccination will be like closing, it will be like putting locks on your doors. At the end of the day, yes, somebody can break down the door, but it's not. But you wouldn't say I'm not gonna lock my doors because someone could break them down. We do know, and lots of people in hospital right now who are very ill with COVID, and the vast majority of them didn't have vaccinations, and that's true now, and that's true everywhere. So there is a great deal of point of having the vaccination. The vaccinations were there really to prevent people primarily becoming very ill and very unwell. And as Dr. Patel said, to allow us to move on to the country to move on to a better place. So I understand it might seem a bit confusing, but I think that's a really important point to know, because there are lots of people who have not been vaccinated, who are not very well right now. So there is a point, and it's a big important point to have those vaccinations so you can get as much protection as possible.
Yeah, Patience, I can see your hands up.
So we talked about how there's different vaccines. So my question is, if you're in a household of, let's say, 5, and each of you get like not the same vaccine, like what does that does it still protect you? Like, do you, in a household, do you all have to get the same vaccine?
No, you don't have to have the same vaccine because you know, for the younger age group, we're recommending the vaccine and not the AstraZeneca. So you know, you might have your parents who are over 40 who've had the AstraZeneca, but the younger ones will get the Pfizer. So it's not important that everyone has the same vaccine in the household. What is important is you've got vulnerable people living there, everyone ought to be vaccinated in that household.
Can I add something?
Of course, please.
Just to say that the vaccines don't contain virus. Just, I don't know if that point has been made already.
No, it hasn't yet.
Yeah, the vaccines don't contain virus. And I apologize for using this example, but everybody knows Ferrero Rocher chocolates.
Yeah.
You know which ones I mean?
Yeah.
So it's got like the hazelnut in the center,
Mhm.
and it's got like the spiky bits on the outside. The virus is like that. The virus is like the hazelnut inside, and the spike protein that we talk about is the outer coating. Now, the vaccine never uses any bit of that hazelnut that's inside the Ferrero Rocher. Okay, so the vaccine does not contain the virus. The vaccine contains bits of the outer coating, usually, to make your body produce an immune response, but it does not contain the virus. You can't get COVID from the vaccine. So I just want to make that point really clearly.
Can I say something?
Yes, of course.
There's a chap there, Rene, he made a valid point about Deliveroo. So if the government and you know, central government, then it goes down to all the GPs, all the healthcare, you know, and it kind of has a pathway to everybody, they're not able to reach out to people to have them vaccinated. Okay, young, middle-aged, whatever. I caught COVID in January and I was sick for 4 weeks. I've got 3 teenage children. We all caught it. And then I was fine. I think my nutrition and my diet helped me recover. So, and in saying that, 5 months later, I had the vaccine because my dad is 80 years old and he kept saying, you've got to have it, you've got to have it, you've got to have it, you've got to have it. Anyway, I went for the vaccine and I was sitting there and I was actually quite nervous to have it, but I had it. And then I had the second one. And I had side effects from the first one, but not the second one. But still, I would say that the nutrition behind my diet helped. So would that not be something that is easier to follow rather than and advertise alongside with the vaccine? Because I was scared to have it, and I do a lot of reading and I looked at it scientifically, everything. I've got family in medicine, but I still was nervous to have it. And one of my children is saying to me they don't want to have it. He's 17 now. He said, I'm definitely not having it. But I find that whole thing about Deliveroo, it's just a bit of a joke, isn't it? Because the children can't really believe in what the adults are saying because the adults are a little bit confused themselves. Yeah. And we can do things at home like good healthy eating and cooking and possibly put that forward with sport. I just want to know from the doctors, people with stronger immune systems due to nutrition, what is the impact on COVID when they catch it, as opposed to somebody that is obese? The obesity is a massive problem if you catch COVID, isn't it? Or if you're diabetic. So would you not say nutrition is quite high up in the ranking of this?
Can I, Angela, thanks very much for those points, and they're really valid points. I think I can speak for my colleagues. We as healthcare professionals want the population, our communities, to be as healthy as possible. My field that I work in is diabetes. So ideally, if everybody adopted healthy lifestyle, if everybody was exercising, if everybody was careful about what they're eating, I wouldn't have as much work to do as I do. And that would make me very happy. Because if we are healthy, that's better for all of us. The unfortunate fact is that we can't all, for whatever reason, sometimes be as healthy as we want to be, perhaps follow that healthy diet, or perhaps exercise and be as active as we want to. That is the ideal, and that's what we'd want everybody to be. And yes, if we had a healthier population, I don't think COVID would have decimated our population.
I think the main underlying point that you're making is that there is so much more we can do to boost our immune systems naturally for ourselves by having better, and there should be more time spent promoting that so that we're in a much better position should COVID come along to deal with it. You know, your recovery's been aided because you were doing the right things. And I think that that's a very strong point and one that we can take on board. So Dr. Patel, please.
Thank you, Michael. I was just going to come back on that point about nutrition. I think, look, Joan St. John has eloquently said what we all think, which is, you know, if you have a healthy diet and a healthy lifestyle, you know, your chances of getting over illness are much better than somebody who doesn't have that. That's a fact. I think we need to be very wary about, you know, particular cases, because I could also point out to a lot of athletes, friends of mine who are very, very fit, who watch their diet, who eat nutritiously, who regularly exercise, who come across with COVID. So it's not by no means a given. But I think what we can all agree on, that a healthy diet and a healthy lifestyle is good for everyone and helps your body recover better from any kind of illness. But I wouldn't like to go away from this meeting thinking that that is the only thing that's going to stop us from getting COVID. I'd still recommend vaccination for everyone who's eligible.
Okay, thank you, Doctor. Renee.
I got two questions. Just one, is this, with the vaccination, will it be a repeat thing? So like the flu jab, you've got to take that every year. Will the vaccination be a repeat? And also, for example, when the Euros was on, it was like all responsibilities just kind of went out the window because England was kind of playing like 60,000 in the stadium. There were everyone's in Wembley, touching, screaming. Like it was like for the whole week, COVID wasn't around, and it was like just do what you want, guys. So how does that work as well?
Well, I'm going to let the doctors answer the second question. The first question, unfortunately, fortunately, it was answered earlier in the discussion, whereby the doctors explained that there is a booster program coming in September, and very much it's a bit watch this space. That at this moment, we don't know if it's going to be something that needs to be done on a more regular basis. They're still watching that. So it's kind of open-ended. Have I got that right, doctors?
Yeah. And also, Renee, it's more likely to be for the people who are more at risk, so the older age groups.
Okay.
Okay. And the second part of the question, the it's coming home argument of packing out the statement.
Sorry.
I think, you know, I'm going to be perfectly honest. I think there was a lot of us who are really skeptical about all this, and you know, this again goes back to consistency in your strategy, and you know, I'll say no more about that, but I can completely understand, you know, why people would think, well, you know, how comes 1 week you can have 60,000 people mingling and the antics that we saw going on at Wembley, how can that be perfectly all right when we're in the midst of a pandemic? I can't answer that, and I can't defend it.
Yeah,
and I think that is probably a good place to come to because we could go on for hours, but I think the young people, that last point is something that the young people would have seen, would have witnessed. You know, we're saying one thing to them, and then we're packing out stadiums around football, and it is a confusing message. And I think that, and I don't know if the young people, anybody wants to speak, I'll ask Patience to say something. I think now that you've heard from the doctors, would it have been good for you guys to have more access to people like the doctors who have come onto the forum, so that there's a bit more balance brought to the argument issue? Patience?
Yeah, I feel like this conversation that we've had for like the past hour, even though it hasn't felt long, it's opened my mind up to a lot more things. Because where I was an hour ago isn't where I am now, and I feel like the knowledge that I have now is it's given me reassurance and safety on like the vaccine, and all the questions that I've asked have been answered and they've been backed up with facts. So yeah.
Okay. Oh, Dr. Joan, you want to say something, please?
Yeah, I thanks very much for that. And once again, sorry I was late, but I also think we always, whenever we do anything like this, we have to remember the people that we've lost.
Yeah.
Because Brent was really severely hit, right?
Yeah.
And some of us are going to have relatives, friends, colleagues, and I think we can't do anything like this without remembering them. So I just want to make that point, that we should always remember them.
That's a fantastic point. Renee, you've got another question. Your hand's up. Or is it not down from the other one?
Because I joined in late, I don't know if this question got answered actually.
Go ahead.
Is there anything, I think more young people also worry about the long-term effects of the vaccine. So is there anything that could harm you in a few years' time, later on in life? Dr. John Licorice.
Yeah, thanks, Renee. As I think I mentioned earlier, vaccines are an established thing. We've been doing vaccinations for a couple 100 years. And that question is asked every time we have a new vaccine. And people are quite right to ask it, whether it was HPV, hepatitis B, people also ask this question. And what we do know is in these very modern vaccines is that there are no long-lasting effects. However, because vaccines are tested, and vaccines are tested, now I just want to make this point, they're tested more than most of the, if you go and buy a fancy cake from, I don't know, IKEA or Costco, it's not tested as much as these vaccines. And most people don't look at the ingredients, you just eat it. These vaccines are tested a lot and they're continuously monitored along with the time. And the way they make, there is no reasonable reason why you would expect to have any long-term consequences. However, and I want to make this point very clear, we know COVID has long-term consequences. So it's not a matter of whether it does. We know it does because some people are having long COVID. There's some people who've had long COVID and have not been able to go back to work since. And we still don't know what long COVID will or won't do. So I think always when we talk about the vaccine, we need to look at, don't just look at, think about the vaccine, think about the virus. This virus has killed a lot of people in Brent. It has lots of people in Brent really unwell. And I think we all need to, as a community, need to do all that we can do to help to mitigate against that in the future. So hopefully you would have found this information usefully. And again, feel free to discuss it among yourselves. We made an offer earlier. We're very happy to find time to come and speak to any form of young people in Brent at any time about this, because it's something we feel very impassioned about. We accept that there's confusion. I'm not even going there with the stadium problem is. We accept there's lots of what appear to be mixed messages, but our message with regard to vaccination is reasonably clear. We want to give people the information, want you to make a good decision, and then if you choose to get vaccinated, be vaccinated to protect yourselves and your family and keep yourself healthy.
Okay, I can see, and I'm just going to be the last question. I can see Mikhail, Patience, and Marley have a question.
It's not a question, but I would like to thank all the doctors for giving us this information. And I think like more like young people should actually like search up or research about the vaccine, and like it should be told within schools about
and have more open discussions.
Yeah, open discussions to like help children actually know what's going on around the world, not just, oh, it's about the adults, it's not about us. So I would like to say thank you very much.
Yeah,
I think it's good to have like aware about it, and yeah, sure.
Great
in these type of meetings.
Great point. Now listen, I'd like to say, the doctor, you're saying something?
I was just going to say that in these sort of forums, this is an opportunity for us to hear from you as well, and we learn as much as you might have done. So thank you for inviting us to this forum, and as John has said, we're more than happy to come along to any other venue.
Well, we've been privileged here at the Jason Roberts Foundation to do this. I'd like to thank you, Dr. Patel, Dr. John Licorice, Dr. Joan, those of you who've taken part, Angela, Renee, everybody in the forum. It's been very, very much appreciated. But I'd also like to thank Marie and Kate for doing the things there on the keeping the chat going and posting the information. One of the things that we are going to be doing is this is going to be recorded, is being recorded, it's going to be edited, and we want it to be shared on the platforms so that other young people get access. But I'd like to say the last thank you to Mikhail, Patience, Marley, Fantasia, and all the young people who have contributed and given us their point of view. This is all about you, and we thank you. Thank you very much.